Hi guys, welcome to Dr. A YouTube channel. In this video we are going to talk about axillary nerve. First I will name the parts of this diagram. Here you can see the teres minor muscle. And this is teres major muscle. And here in blue color you can see the long head of triceps brachii. And this is scapular bone. Here you can see the humerus, and this is deltoid muscle. And in its diagram, here you can see the quadrangular space and triangular space. So before we talking about the axillary nerve, I'll describe about these spaces first. So this quadrangular space is bounded by superiorly, that means from the above, by this teres minor muscle. Inferiorly, that means from the below, from this teres major muscle. Medially, long head of triceps brachii. Laterally, from this surgical neck of humerus. So those are the margins of quadrangular space. When we talk about the triangular space, here you can see the space in triangular shape. It is bounded by laterally by the long head of triceps brachii. Superiorly, that means from the above, by this teres minor muscle, and inferiorly from this teres major muscle. Now let's talk about the axillary nerve. Axillary nerve arises from the posterior cord of brachial plexus. And this carries fibers from C5 and C6 spinal nerves. And after giving a branch to the shoulder joint, this axillary nerve divides into anterior and posterior branches. Here it gives a branch to the shoulder joint, and then it divides into anterior and posterior branches. So this axillary nerve passes through the quadrangular space. So here you can see that. Apart from this axillary nerve, the posterior circumflex, humeral artery and vein also passes through this quadrangular space. After passing through this quadrangular space, the axillary nerve divides into two branches as anterior and posterior. So this anterior branch continues horizontally with this posterior circumflex humeral vessels around the posterior, that means backside of the surgical neck of humerus, and it supplies deltoid muscle and also gives some cutaneous branches which pierce the muscle and supply the overlying skin. So here we can see the perforating cutaneous branches. So this is the anterior branch. It supplies the deltoid. And here you can see the posterior branch. This branch supplies teres minor and posterior part of the deltoid. So it supplies teres minor muscle and posterior part of deltoid. And then this pierces deep fascia and continues as superior lateral cutaneous nerve of arm. So I'll give a brief idea again about this axillary nerve. So after passing this quadrangular space, this axillary nerve divides into two as posterior and anterior. Anterior branch continues horizontally with this posterior circumflex humeral vessels around the posterior part of surgical neck of humerus, and it supplies the deltoid muscle and also gives some cutaneous branches. Here you can see some cutaneous branches which pierce the muscle and supply the overlying skin. So they are perforating cutaneous branches, and this posterior branch, it supplies teres minor. Here it supplies teres minor and also the deltoid muscle. And apart from that, it pierce deep fascia and continues as superior lateral cutaneous nerve of arm. So that's all about axillary nerve. I think you could get a clear idea about this nerve. So if you like this video, please hit the like button and don't forget to subscribe my channel. Thank you guys.